All right. Great. Well, I'm glad you guys are here for the webinar about data. That's what you're expecting, right? Data and dashboards?
Yes.
Yes.
What?
Great.
Yeah.
Great.
Wrong one.
Yes.
Yes.
Yes, exactly. Is this the plane going to Denver? Right. Excellent. So what I want to do with you guys in the next 50-ish minutes is cover with you some basic information about data and performance dashboards. Basic information meaning that at the learning session, we're going to be adding on to it even further. But, oh, Paula, is that you from Communicare? Hello, hello. Paula, can you hear us? Yeah. Oh.
Saw the little icon. Paula, say something.
Paula. Yo, Paula. Whoop, whoop. She might be working on her microphone. Okay. She'll chat us, I guess, if she can't get through or she can't hear us. So the reason why this is kind of basic information in the sense that we're going to be building on this at the learning session on September 4th. And this information that we cover on this webinar will not be covered at the learning session. So this is information you're not going to get again in any other way. It's not like you're here and it's going to be redundant. This is going to be assumed that by the time you get to the learning session that you've got this. And this information is information that you're comfortable with. Okay. And what you are going to be receiving from Carlos, if you haven't already, is a slimmed down version of our Coleman Associates dashboard. Now, after this session, you have options between now and September 4th. You can look at it and say, this is way more than we need. You can look at it and play with it a little bit. Oh, Paula, you want a phone number. Yes, there is a phone number you can call into. Let me give that to you. Do you have a pen handy, Paula? You can't tell me, so I'm going to assume. Okay, it's 415-762-9988. I'll repeat that, 415-762-9988. And the meeting ID is 994-906-444. 994-906-444. I'm going to try and chat that to you, but I don't know for sure that it's going to make the trip. So we'll see. So this dashboard you're going to be getting is an Excel file, but it's a kind of a complex Excel file because it has pivot tables in it. It has conditional formatting, meaning that if a square has a number in it that's above or below a certain point, it'll turn a certain color. The font will turn color, etc. So if it's something that you don't feel comfortable with or don't feel like you have the Excel skills for, you don't have to do it. We can give you a paper version, or if you feel somewhat comfortable, you can attend one of the breakout groups on September 4th. Just bring your laptop, attend one of the breakout groups, and you can walk through with us how to do it. Okay, so your goal at the end of this session is to understand what the dashboard's for, how you might use it, and then figure out what you want to do as a team about this. Does that make sense?
Okay.
Okay. Any questions?
So far, no.
Great. Great.
Soon for questions. We got to know what we're dealing with.
Exactly. I just want to make sure you're clear about what the learning session and the expectations are. So perfect. So what I want to do is I want to share my screen with you so you can see a little bit of the dashboard that I'm going to be showing you. I'm going to give you several examples so you can see exactly what they might look like. And then from there, we'll talk through why you have the dashboard, what we'd be doing with it, and what are some possible options for you guys in terms of what you might or might not want on your dashboard. Okay? So here we go.
Oh, snap.
Okay. Can you see the screen?
Yes.
Beautiful. Paula, can you see the screen?
Yep, can you hear me?
Oh, we can.
Okay.
Great. Rachel, can you also see the screen?
Yep, looks great.
Great. This is that's the last of my technical assistants. Are we all here? Questions then? Great. So let's get started. A performance dashboard is very simply a tool to use to communicate with people about their metrics. It's very, very similar to the way you use a dashboard in your car. So that's the analogy. These things, now people approach us all the time and say, oh, we have a great dashboard. We'd like to be able to provide this to your clients or sell this to your clients. And a dashboard that can attach onto your EMR can be very costly, $80,000 up to a couple $100,000 from different companies that I've worked with and previewed dashboards of. So what we want to give you is just something that's in Excel. You can run it on any computer. It doesn't require special licenses or big expenses. Just to take a step back, remember the whole point of going through this data and looking at this is because we want to make sure that we're taking care of patients the way that we want to and the way that we know they need to be taken care of. And we're looking at that from several different specific components. One is this whole access component. Patients want to get in, they want to see us, they want methods to reach us, and they want the visit to go smoothly. They want their time to be valued, and they want to get the care they need. So while you may or may not think you're doing that, we want to provide some objective metrics for that. Okay? So let's pull together a little bit about what we know about dashboards, and let me give you an example of what I mean when I say dashboard.
Those are dashboards. Okay.
Is your screen big enough that you can take a look at this with me and look at these set of charts?
Yes.
I hope so. Great. Thank you, Antonio. You're like the voice.
Oh.
Stack Bam Bam. And also the shadow maker. Or the wave maker. Okay, so up in the top left corner, you can see this line that looks like it's trended down.
Mm-hmm.
And it's kind of bobbled along, had a teeny peak here, otherwise pretty much bobbled around this 50-ish minute mark, right? But you can see the green line is at 35, so that's their goal. One way to represent things on a dashboard is just a simple line graph where green is good and red is bad, and everything in between just shows you their progress. Or you can look over here on the right-hand side. This is a way that this particular site chose to show their average visits compared to what's the expected number of visits per session. So in this particular site, the orange was the average visits per day, and blue was expected. And you could see where they got themselves to the point where they were pretty consistently hitting over their expected, but it took them until like early August for this team to get to that point. Right? Before they were below, and then they were kind of at it. Now take a look at this middle pie chart. What does this tell you? What do you see just by looking at it, not even knowing this site?
The bad is 25%, the good is 75.
Exactly. Pretty intuitive, right?
Yeah.
Like 3/4 good, 1/4 bad. Exactly. And you can tell it has to do with collections. Must have to do with money, percent collections. That's really all you need to know. You're looking at it to have a reaction. It's like, oh, okay, most of it's green, not bad. Could be a bigger portion, but not bad. What about this confirmation call pie? What does that tell you?
A quarter confirmed, then the other one voicemail, and one not really confirmed, or I don't know. There's a 2% that's kind of hard to see.
Yeah, the 2% is obviously something bad, but it's small, right?
Yes.
Mm-hmm.
Yeah. And then everything else, there's like a third of it is good, and the rest of it seems kind of meh. Somewhere kind of middle of the road, absolutely. What do you see down on this bottom one with the third next available? What do you know about this site just by looking at this chart?
I think TNA was really high, and then it started improving.
Uh-huh. It improved wildly over the course of just a couple weeks.
Mm-hmm.
They've only touched their actual goal once, but they're much closer to it now. Exactly. And then nurse visits. Now, for you guys, Stack Family, you don't have nurse visits, but Paula does over at Communicare. And this is a place that started out with no nurse visits and then kind of trending up slowly. You can see their goal is way up at the top there at 12, but they're at least making progress. They're making their way forward. Okay. In short, what I hope that you saw through that dashboard and what you're looking for is some way that a few key visual pieces of information can provide you with a really focused snapshot of key information so that you can communicate and know what's going on. You absolutely positively don't know the whole story by looking at these. You have no way of knowing if this week when the cycle time popped back up to 60, you have no way of knowing if 3 people called out that day or if there were a bazillion extra patients walking in, but you don't have to because it's just a snapshot. What you're looking is so that something that anybody can view the status and see more or less how we're doing. If I was looking at this and this was my clinic, I would say, wow, we've done much better with access because TNAA is down. Looks like we're doing okay on money, probably could be better. And these confirmation calls is interestingly still kind of a problem. And we really got to do something about these nursing calls, I would say. Then there's just a few key pieces of information there that you can glean and decide whether or not you're being successful or not in your DPI efforts. So what I want to cover with you is just a few reasons why, and then I'm going to ask you what points you're going to need on your dashboard. But right now I want you to think about why you need a dashboard, which is you have to have some sort of a common understanding of what metrics you're shooting for. Okay? If you guys at SAC Family are going to roll this out to your other sites, you sure as heck better have one idea that you're sharing with people about what it is that you're trying to get accomplished. We want to reduce the no-shows. We want to reduce the cycle time. We want to maximize our visits. We want to increase patient satisfaction, whatever it is. You have to have a common understanding and a basic reference point so everybody can see it and agree to it. It has to be objective. There's nothing in that set of charts that I showed you that said that a particular doctor was good or bad, or that a particular person who was making the conference call or confirmation calls did a particularly good job or bad job. All it was objective data. Absolutely objective data. So there's no value judgment, just puts it out there. The great thing about this kind of information is that some people in the clinic will say, wow, that's like exactly what I've always thought. Like, we're really maxed out on visits, or we just don't collect much money, or we've really worked hard and really gotten our access improved and our third next available is really down. Whatever the numbers are, you want people to say, yeah, that feels right. If people say, wow, that's our cycle time, that sure doesn't feel right. Which SAC Family, that's one of your issues, right? Patients are saying, wow, we're waiting less time, but yet your trend looks like your numbers have gone up.
Mm-hmm.
So then that tells you something's not quite right with that charting and that information, because if patients are saying it feels faster, and you guys feel like it's faster, the trend should also show that so that it validates what people are saying. Otherwise, you don't have credibility. The thing I love most about a dashboard is that looking at it, and that one was a set of charts. It wasn't actually that great. I'll show you some better ones here in a second. But it imposes kind of a call to arms, like, oh my gosh, we've got to get better at those confirmation calls, or whoa, we got to get better collections, or whoa, look at our missed opportunities. You want it to cause that kind of visceral reaction. You says, oh my gosh, we got to change this piece. And then the last thing about a dashboard, and the reason why it's so helpful over time, it is a snapshot, but you also are tracking some trends because it allows you to see things that you otherwise would miss. You may have seen this optical illusion before, where there's these three figures. They're actually all the same height, but our eyes tell us that the figure in the front is smaller and the figure in the back is bigger. Right? But it's just because the outside has changed and the environment around the figures has changed. Measurement removes the bias. You put a ruler up next to it or anything to measure it, and you know that they're the same. Same thing with this one. And I showed some of you this at the leadership conference. This blue dot is the same diameter in both of these. But in this example on the left, the blue dot looks huge. And on the example on the right, the blue dot looks tiny. The blue dot has not changed, but the environment around the blue dot has changed. And in my experience in clinic life, things can get so chaotic sometimes in clinic that it can feel very different than it really is. It can feel like the cycle times are really long or things are really painful, and sometimes it's not. Thoughts about this, thoughts about the data, and thoughts about the dashboard?
It looks pretty helpful.
Okay.
Especially rolling it out to other clinics, and they could actually see the numbers instead of explaining it to them word for word. This way they could actually have a good visual view of where they stand, and it's a pretty good helping tool to see what we must accomplish to make it better. Or yeah, absolutely.
So I want to know. Oh, go ahead, Rachel.
Oh, sorry. I was just going to say really quickly, I think that your thing on perspective and sort of looking at the blue dot is also super helpful, because baseline too, how you show things, even when it comes to the data, how you show things in reference to other things can make a big difference in how people interpret them. So that's really useful to think about it that way. That's cool.
Oh, yeah.
Absolutely.
Orange dots.
Are there any data points you use in your personal life? Anything you look at? Do you guys do like your credit card, do your bank statements online where you can see this kind of stuff?
Yeah, my bank does that when I go online and like, oh my God, I spent so much on junk food. Or it's pretty cool. Like Golden One, the credit union, they actually have that set up for you to actually see the whole chart, the pie chart, and it shows exactly where your money goes. So that's pretty helpful.
It is helpful, isn't it? And it can be astonishing sometimes.
So I know which area where I have to cut down on. So that could help with the patients as well as like which area does it. Yeah.
Absolutely. Paula, what about a Communicare? Are you guys using a dashboard?
We are. And I think sometimes we're a little caught in the
A
volume.
little louder.
Oh, okay. It's better?
Mm-hmm.
Okay. Sometimes I think we're so caught in the actual tasks and what we're doing that we forget about the dashboard, but we do have it and we do use it.
Okay.
So, yeah.
Excellent. Excellent. I was on a call today with a team that we trained in Northern California 3 years ago. And one of the women on the call said, her name was Bridget. She said, Bridget, she said, Melissa, I have to tell you. We use that missed opportunities on our data sheet every week. Because she said, while I care about the no-shows, what I really want to know is everybody at the front doing everything they can to fill every no-show with a walk-in. She said, when I see the no-show numbers and I look at the missed opportunities and I see our missed opportunities are 0, I care about the no-shows, but not so much. She's like, we've overlaid them on our dashboard so that we can really see them. And they're still using it. So I feel like it can be a very helpful tool for places. But you're right, Paula, sometimes you get so caught in what you're doing, you kind of gloss over that.
And actually, sorry, Melissa, just to clarify, every time I hear dashboard, I think of a few different things. But anyway, so no, we definitely use that data, and do it every week, and it's very, very helpful. So we are doing that piece.
Great.
Yeah.
Good.
Yeah.
Excellent.
Yeah.
Excellent. So here's some things that I want you to think about when you think about what to put on your dashboard. And every site can have a little bit different dashboard. Paula, you guys already have one, but that doesn't mean that the metrics that are on there now are the ones that are best suited to you. So I don't want you guys to say, oh, we already got this. I want you to really rethink it because you're kind of at that version 2.0 level. We have to think more critically about these components. So there's some things that you find on a dashboard of your car. The analogy holds, so use it. A speedometer. I mean, I don't know how you would drive a car if you didn't have a speedometer. I did a road trip once across Wyoming. Don't ask me why I was doing that, but I was doing a road trip across Wyoming, and my speedometer in my car, the cable broke. And I watched the speedometer thing like go down, like from 65 down, but I was like confused because my car looked like it was going the same speed. And I had to drive the rest of the way home without a speedometer. And it's really hard because you have a sense of how fast things go, but you become so dependent on looking at that. Like every time a state trooper drives by, like, tell me you don't look at your speedometer. You enter a school zone, you see a flashing red light, you glance down at it. It's something you don't spend a lot of time. You don't pull a report on your speed. You don't wait till you get home and then print out a report on what your speed was every 5 minutes of your drive. No, you just look at it right in the moment. So it's a measure that's critical to safety. It changes frequently, calculated in something that more or less resonates with you, and you can just see it all along the way. This is a great metric for cycle time. This is a great metric that falls in this category of missed opportunities. There's a number of things here that you're going to want to measure on a really regular basis on your dashboard. The next set of metrics fall into the same category as your odometer. I don't know how about you, but I don't look at my odometer a lot, but I do look at it. And if I'm going somewhere new and they say, well, it's about 3 miles until the turn, I totally look at it.
Right.
And then in those moments, I want to like reset that little trip odometer to 0 so I can kind of see where I'm at. You may use it to measure how much fuel is left in your car. So it's not something that you use as often, but it's critical in terms of it affects you. It affects where you're going, the distance. It affects your resale value of your car. It gives you information about when to put gas in, when to service. So for those kind of purposes, we use it. It's a little longer timeline. The next one is a fuel gauge. So a fuel gauge is just something that simply tells you kind of where you are in the whole scheme of things. I find that a fuel gauge is one of the things that obviously you have to have an idea about, but clearly people weren't using it well enough, or they wouldn't have all given us those alerts now on newer cars to tell you when your fuel is low. So we need some sort of an alert. So an alert that's akin to this might be something like a lot of missed opportunities, or it might be how much people are getting out to lunch on time. It may be closed notes and charts. Those are all things that might fall into this category of things you really do need to see periodically to know it's going okay. And then the last one is the oil pressure warning light, the engine warning light, because it gives you a heads up on potential failure. And so those are things. Now, one site that we worked with in Salt Lake City, and this is interesting, you may or may not have this problem, but this is something they put on their dashboard, which was staff were calling out a lot. And since staff were calling out a lot, they made a dashboard for each team, and they put how many people had called out each week for the team. And they posted that publicly. They didn't say a person's name. They didn't say, Blanca called out 4 times this week. They just said that this particular team had 4 call-outs this week. And this particular team only had 1 call-out this week. And this particular team had 8 call-outs that week. It was a way of giving a heads up to them about how they were doing.
Is it like calling in sick or calling?
Yeah.
Oh, okay. Not using the company phones. Okay.
Yeah. No, calling in sick.
Yeah.
Because they had a huge problem with staff calling in sick and like a morale issue. So they started measuring it by team. And I'll tell you, it took about 3 weeks before people stopped calling out. Because nobody wanted to be posted on the wall with the other teams and be like, oh my God, our team has tons of people calling out compared to the other teams. It fixed itself. Nobody said that those call outs were not legit. Nobody said that that wasn't okay. Nobody said that that was a use or not of the policy. That was between them and their boss. But just simply making that information public and posting it communicated to people and spoke to them in a way that they didn't want to be that outlier.
1 minute, right?
Do you have things like that that you might want to put on a dashboard?
Do we have things like that? Who comes in a minute late? I'm putting them on that dashboard. I'm not playing.
Talk to the phone.
Not here. I don't think so. But
No. Yeah, because we have a same day slot. So
What's that again?
we have a same day slot allotted for the patient. So either they're late or
no, it's just about us, the patients, if we want to do it.
Yeah.
Not, I mean, like.
I don't know.
Yeah, but
Just
we
that.
have a problem that people call in sick too much here.
we have coverage. Don't worry about it.
No.
Not here.
No, yeah.
What about Communicare and Rachel?
Yeah, this is Paula from Communicare. One of the things that pops into my mind is we're having a hard time with some of the teams getting started on time, like with a quick start. Some of them are great, and some of them are a little slow. So maybe just putting on this team A was however many teams got started on time for the morning or the week or.
Mm-hmm.
That's a great idea. Competition. Usually one team wants to be better than the other one. That is a really good idea.
Yeah. We have had teams that have posted that quick start data, how many teams got a quick start and how many minutes late they were for starting on average. We actually had a specialty clinic near San Mateo that posted a chart of every provider on their specialty days when the specialist comes in. They had a chart of every provider and how late they were for clinic. And they ranked them. And the providers were like, I wasn't that late. They were like, yes, you were. And it started to shape behavior just because nobody wanted to have that super tall bar.
He doesn't care.
Who's here?
Rachel, anything you want to add in?
No, ma'am, just enjoying listening to the dialogue.
Hi. So there's a few things that are not on a dashboard, and this I have to warn you about because it seems to me like every management team, when they hear that you're gonna create a dashboard, they immediately decide that there's 6 things that they really care about that they want on the dashboard. And my thought is make a separate dashboard. If you need a separate management dashboard, because if it's stuff that has to do with grants or stuff that has to do with the people who aren't actually doing the work, it doesn't belong on a dashboard. There's a set of things that don't. For example, a valve wear gauge. Kind of like, that's something that happens so slowly you can't measure it. Overall, like decrease of patients annually and things like that, you can't necessarily measure that. Don't put it on your weekly dashboard. Then there's things like crash indicator, things that like tell you something that already happened. Like use a different mechanism to communicate something that's already long since passed that doesn't require confirmation. And then there's things like paint fade pattern that I would say are irrelevant. If there are metrics you're grabbing for a grant, but nobody really cares about it. If it's something that somebody in your frontline staff, if you took this to somebody else in your clinic and said, hey, look at this, what do you think of it? And they say, I don't know what that means, or I don't know why I should care. Listen to that, because that's really important, and that means it probably doesn't belong on your dashboard. Either that, or you need to do a better job communicating.
Okay.
Okay. So here's some things that I want you to take a look at these that you might want to include on your dashboard. These are operational measures. There's no clinical measures here, but take a look at these operational measures.
Drop calls.
You get a shot of it?
Yes.
Okay.
Yeah, we're actually looking at the drop calls. So we do phone reports, and we're actually looking at the drop calls, which is really very informative.
It's super informative, isn't it? Whether you call it drop call or abandoned call, whatever you call it, it means people can't get in and they punch out. And I mean, it's no wonder people don't call and cancel when they can't get through. You'll recognize these first 5 measures, right? Because you're reporting those to us every week anyway.
Yes.
Mm-hmm.
The only one that's not on there is capacity used. The reason why is because it's a little esoteric. It's a little, it takes a little more explanation. It's not quite as intuitive what capacity used is. And missed ops gives you more or less the same thing. So we're going to ask you to collect capacity use throughout the rest of the collaborative, but it's not necessarily something I recommend people put on a dashboard, because if you go around and show it to the other staff, they might be like, what does this mean?
Yeah.
And you're better off doing something like that, productivity, like that first chart that I showed you where they had the number of visits seen versus the number expected. Are you guys measuring continuity of care?
Care to elaborate on that one?
So what?
Continuity of care. Have you heard of that one before?
No.
It's
Well,
like
oh.
So continuity of care, yeah, and there's no reason why you would have heard it, so there's no reason. So, but continuity of care is measured in 2 different ways, both of which are very valid, and either one of them is telling. It kind of depends on your culture. I don't know. Dr. Van Meers, you're there, right?
No. I didn't.
You're not there. Okay, so that just to make sure. I didn't know if that was him. Okay, so continuity of care refers to how often a patient sees their PCP.
Okay, that makes sense.
So you could pull the data 2 different ways. You could pull Dr. Van Meer's data.
Yeah.
And of the patients he saw this week, how many of them had him listed as a PCP?
All of them.
So that means from his perspective, that's totally coming from his perspective, 90% of them or 95% of them, depending on, the other PA in the house, 95% of them are his patients. In your small site there in West Sac, it's not a big deal, but in some of your other sites, it might be. Mm-hmm. And if the provider saw their own patients consistently, they're going to tend to have a higher job satisfaction. They're going to tend to have a higher level of connectedness to the patients. The patients are going to feel greater relatedness, just like how loyal Dr. Van Meer's patients are to him. You want that loyalty because of continuity. Now, another way, Anton, that you can do the same continuity metric is you can say, how many of the patients we saw this week saw their assigned PCP?
All right.
That's from the patient perspective of, do patients come in and feel like they generally see the same provider? Again, in West Sac, it's not a big of a deal because you don't have a lot of choices.
Exactly.
Yeah.
But in your other sites, you guys are going to have to be the experts for your other sites. You're going to have to think about that. Okay. Cash collections is pretty important in terms of whether or not we're collecting the co-pays we should. Payer mix. Paula, do you guys do payer mix on your dashboard at Communicare?
No, not the one that I see. Sinelli may have that, but actually not Sinelli, but one of our other folks may have that, but not on a regular dashboard, no.
Okay, not something you guys see.
Not something that we share. I mean, I can obtain that information, but it's not a shared routine thing that we look at on an operational level, no.
Sure. It's definitely something that a management team would look at. The payer mix is that percentage of people that have different sources of coverage. So for you guys, SAC fam, since a lot of your patients have insurance or Medicaid otherwise or partnership, you're going to see what that balance is between them. In community health centers, they absolutely need to make sure that their uninsured people are on some sort of plan whenever possible, because they don't make much at all on those uninsured people. And then quick start and soft landing, that's what you were referring to, Paula, in terms of a metric you had on your dashboard, right?
Right.
Great. Excellent. Telephone encounters and messages, it's another great thing to have on a dashboard as well, especially if you're getting killed by messages and extra work. So when you think about your dashboard and what you want on it, which you're going to have to do at learning session 4 and after, you guys dialing?
Who, us?
Yeah.
No, we're just showing something.
Oh, got it. Okay.
Yeah, we
I saw
want to get fancy dashboards. That's a, okay.
What's that?
Just looking through the dashboard, just a little thing going on, but it's okay.
Nice. No, there's tons of them. No, that's okay. I just didn't know if you were like dialing. Okay, so there's several things you want to think about when you create your dashboard. First of all, what's your mission statement, whatever it is? What's your bottom line? Is there any impact on budget, productivity, payer mix that you have to pay attention to? What kinds of efficiency metrics do you need to pay attention to in terms of phone stuff, in terms of messages, non-visit encounters, drop calls, productivity, all that, customer service, patient and staff satisfaction, access metrics, as well as clinical measures. If you show a dashboard to a bunch of clinical people and it doesn't have any clinical metrics on it, most likely your providers are going to say, what the heck? Like, it's just all about operational stuff. We need some clinical stuff too. So it really depends on how you want to communicate to staff what metrics you need. Paula, do you guys have any clinical measures on your dashboard?
Sorry, you were on mute.
Oh.
And I was just typing you something. I was like, can we get this in PowerPoint?
Cool.
So I was a little distracted.
No
What was the
worries.
question?
Do you guys have any clinical measures on your dashboard?
Yes. So we have like the TNAA, we have the missed opportunities. Yeah.
Yeah, I would almost consider those, excuse me, I'm a new cough drop. I would almost consider those operational measures. And when I think of clinical measures, what I'm thinking of, like, do you have any diabetic screens or any?
Oh, yeah, no. Yeah, no, we don't have that on a regular I mean, Sinelli has a lot of data that she keeps track of, so that is tracked, but not on a regular dashboard that we've, I think, gotten probably from Coleman. I mean, that we implemented from Coleman, yeah.
Okay. So the dashboard you're going to get from us has a whole menu of things to choose from. On the bottom of the first page, it says, this is your setup page. It's got a menu of things, financial things, operational things, and clinical things. You might use it if you have like behavioral health screening you have to do or health maintenance. Click the ones you want, check the ones you want, use the ones you want. Just keep a balance, and just like the dashboard of your car, you can't have like 6 zillion things on it. That's why Sinelli keeps a bunch of data reports, because you can't keep track of that many things. So the dashboard has to be a pared down version, and sometimes those clinical measures go by the wayside, but I really like when teams have a couple of them on there and track the results of those. So, and when you think of how often and when you measure things that change slowly are things that you can measure monthly or quarterly and just put on a quarterly dashboard. But then there's other things that need to be measured and recorded on an hourly, daily, or weekly basis. You'll have to figure that out for yourself, so don't worry, there's no rules about it. Okay? In terms of how you collect this information and what kinds of measurements you're doing, think oftentimes it's helpful to think about it in terms of workflows. Like, are there things that you log, maybe in a lab, or vaccines? Are there things you have to do audits on, things that you have surveys around, mystery shopper things that you do? Do you pull timestamps from your practice management system or your EMR? Is there budgetary information that you have to print and report out on? Are there specific health indicators, smoking cessation counseling, any things like that that you keep track of? And then any peer reviews that you do, either provider to provider, MA to MA. And then there's a whole set of metrics that I also want you to keep in mind that are IT based. And yeah, I will send this over to you, Paul, because you might want to think through some of these options. You may have registries in your EMR or your practice management system. You may be tied into the vaccine registries or the CHDP kinds of systems where you can see where the physicals and the immunizations are happening. You might be using Bridget to pull some data out, or you may be getting data from partnership that you want to put on your dashboard as well. Anything else you can think of that you might want to use as data points or measuring? Anything you're using now, Paula?
Not in addition to this.
Okay. This was our exhaustive list. Rachel, can you think of anything else?
No, nothing outside of what you've mentioned.
Okay. Okay. This gives you a lot of different places to turn for numbers and information for sure. Okay. So to me, this is the most important part of the whole dashboard deal, to be totally honest. And we have 20 minutes left, but we won't spend the whole 20 minutes. But this is the most important part. So you need to like rally around this. Here's the deal. The dashboard is not intended as a report. I recently had a client of ours who started pecking on me for dashboards and data and information. Not you, Rachel, of course. Somebody who was pecking on me for like 60 pieces of information. And finally I said, guys, that's not the point of the whole deal. The point of the whole deal is not for me to produce 60 reports for you, especially when I didn't even know they were out there. The point of the whole deal is that we communicate what's in the reports every week as it's happening so people can see it and be like, oh my God, we got to change this. We had 17 missed opportunities this week. Or, oh my gosh, we had, 18% dropped calls. That's 18% of people who got tired of waiting for us and hung up. That's terrible. So you want to make sure whatever you put in a dashboard is really used to give you direction and to show you what you need to be doing as an organization. So none of these are negotiable. None of these are negotiable. To have a good dashboard, it has to be public. I never, ever want to hear a team say, oh, well, I don't have the dashboard because so-and-so has it. It's like, well, that's not the point. Do you have a sheet of paper? Yes, great. That's enough. That's all you need to create a dashboard. Grab a sheet of paper and a ruler and start making some charts so that you can see what's happening. It has to be public. It has to be transparent, meaning everybody can see it. If the data sucks, that doesn't mean that you don't show it to people. It has to be transparent because the only way you're going to get better about it is to know about it. It has to be simple, one page, period. One page. If it gets too complicated, then nobody looks at it. It's like all the other stuff you get in your email. You're like, I don't know what this is, but this is like way too long to look at. And then you stop paying attention. It has to be understandable, even to a novice person. Anybody in your clinic should be able to walk up, you should be able to show them this dashboard and say, what does this look like to you? And if they can't respond, just like that first dashboard I showed you, so what does this chart show you? You didn't know everything about it, but you could tell things. And that's how it has to be, even if somebody's not trained in it. It cannot be anonymous. You can't hide names and information. It has to be open. Again, it's not a judgment, but it has to be transparent and open. And then it has to be up to date. Once it gets outdated, people stop looking at it, and then you're lost. And the most important thing is it has to be somehow laid out in such a way that the charts show you things that you can react to. It has to stir you to some kind of an action. Our team has been creating a new dashboard. Rachel knows this because she's had to witness our stepping through it. We're creating a new dashboard for the collaborative because the old dashboard we had, and as we continued to edit it and hone it, it wasn't stirring enough action. It was turning into a data report. So I pulled the plug on it and said, we have to come up with a new dashboard. Paula, of these, which ones do you guys do best and which ones do you do worse?
In terms of what's
of how you communicate.
Okay. So in terms of communicating the dashboard to the rest of the staff?
Yeah, I mean, is your dashboard public?
Yeah. No, so it's not something that everybody gets, emailed. It can definitely, it's shared so people can look at it, but they wouldn't. So it's shared during staff meetings, but it's not shared that routine of a basis, I would say. So
Okay.
it's something that management's looking at. It's something that, a management team and certainly our Coleman team, but I look at and then Spinelli's looking at and those folks. But the rest of the staff, it's, shared somewhat, but it's not something that they can just pop on and look at. I don't think that they would even think to do it.
Is it simple? Is it just one page?
It is. Well, there's the different measures that we're looking at. So if you're talking about the graph version, it is one page.
Okay.
If you're talking about where the data entry pages obviously are different pages.
Absolutely.
But yeah, otherwise, it's one page.
Okay. Is it up to date?
Yep.
Okay. Good. And does it stir people to action?
It stirs me to action. I don't know. I mean, when I share the information, I think it's certainly, if it's motivating, if it's good news, then it's motivating. I don't know when it's not good news, how much action is taken. Okay,
that's fair. Well, here's the thing with the dashboard. To me, a dashboard is no different than you having a dinner party. How many times have you had somebody come over to your house for dinner? Anybody had somebody come over to the house for dinner?
Yes, I believe so.
Okay, so you have somebody come over to your house for dinner. You cook dinner. Hopefully there's some sort of dinner conversation. As the person who's cooking, you're not necessarily expecting it, but you're kind of hopeful that somebody's going to say something like, hey, you did a really great job on this salad, right? Mm-hmm. Oh yeah, the salad's great. Oh yeah. Oh man, this pasta is amazing. Oh yeah, thanks. That's a dashboard on how you did.
What about that salad's horrible? Anybody say that?
Yeah, if nobody says anything about the salad, social norms would keep you from saying it's horrible. But with data, you just put it out there for what it is. Social norms would keep you from saying it's horrible. But if nobody says anything about it, it kind of makes you wonder, doesn't it?
Yeah.
So that's all a dashboard is. It's in the moment, transparent information. Again, transparent is hidden a little bit by social norms, but we're not bound by social norms at work in the same way, because who cares about social norms? Results make patients better. That's what we're at work for. That's what we're paid to do. Every single one of us is paid to help make patients better. So you have to be kind, but you can't be totally falling for social norms in that case. But it's simple. Someone doesn't say, oh, I'm going to write you a summary after this about how dinner was. You don't get like a summary 3 weeks later about what they liked about it. You might get a thank you card in the mail the next day, but you don't get, it's in the moment, up to date. So do it just like you do life and make it instant, transparent feedback. That's all you're looking for in a dashboard. Hey, you guys sucked at your confirmation calls yesterday. We got to get better at them tomorrow. Hey, we're down on cash collections. What can we do? That's what you're looking for. Something that stirs you to action. If everybody loves the salad, you're probably going to make it again. Easy enough?
Yeah.
Okay. Here's an example of a dashboard that I love. So Coleman Associates started this not-for-profit, the Institute for Boulder Healthcare, to provide further training. And one of our visions is to create a happy little clinic, a clinic where people can learn how team-based care works. And so we took one of our pilot sites that we worked with on rapid DPIs, and we created a dashboard for them, and we asked them if we could borrow it as our model dashboard. And we call it the Happy Little Clinic dashboard. So you see it there. The reason why I'm telling you that is because you can find it on our website too if you want to share this with anybody else. So Happy Little Clinic dashboard. Happy Little Clinic, in this case, it was a site that called us after EMR implementation because their productivity had tanked. So the very top thing on their dashboard, I'm sorry to say, but not really, because it was what was important to them, was productivity. Mm-hmm. Now what they did, instead of making two separate charts, and actually we did this with them, but what we did is we created this chart with both patients per hour and patients per session so that they could watch the trend. And you see how the line is red at like 8.9 and 9.2 patients per session because that's so low? But then they're getting closer and closer and closer to their goal of 11 as their time went on. You can also see patients per hour. Patients per hour remained relatively stable. It went up a little bit, but what they really did is they got more efficient in each hour of their care, so they didn't spend as much time after hours charting, which would decrease their overall productivity. Their missed opportunities, out of 826, now they started out with zillions of missed opportunities every week. But by the time this chart was printed in January, out of 826 completed visits, they only had 13 missed ops.
Could have done better. I'm just kidding. That's pretty good.
It's pretty good, isn't it? That's why it's yellow. It can't be green, but it's not red. Yeah. Look at this. I want to point out this chart in the middle, the blue one that says front office cash collections. You see that one?
Yes.
Okay. So they started out at their front desk. Their front desk hardly collected copays. Nobody in admin knew this, but it only took it didn't take a rocket scientist or a brain surgeon. You just go up to the front and you watch people and they say, well, I'm not really going to collect that copay. And you say, why not? They say, well, because usually when I ask the patients for money, they say they already paid and our billing department's really behind, so then it's not been posted. And then I don't want to ask the patient and then kind of force them to pay money that they probably already paid. So I just don't ask. And what it really revealed was a further misunderstanding about how the billing was supposed to work. And frankly, it revealed among the front desk staff some discomfort around asking for money. So we trained the front desk about how to ask for money. We trained the billing people how to work with the front desk and answer their questions directly. And look what happened. You see their outcomes.
All right.
You see that red line? That was what they expected as a minimum target based upon the patients that were supposed to come in.
Mm-hmm.
They exceeded that by asking patients for past balances.
That's pretty cool.
It is pretty cool because that's all extra money
Mm-hmm.
they weren't catching before. Now at the bottom, you see this phone efficiency data. You see this shadow chart here? This is another great way to show data. Red, as you can tell, is bad. Green is good. Yellow is the overall calls they received.
Mm-hmm.
You can see they had a giant spike that week of January 10th, or that day of January 10th. Spike in calls received and a lot of abandoned calls. So then they ratcheted things up, and you can kind of see how that green line gets a little closer to the yellow there as you move along that week, because they saw they had a problem. In the bottom right-hand corner, you see empanelment 99%, and you see a smiley face.
Mm-hmm.
When we were working with the food stamps office in New York, we were providing them with some data, and Seth Diamond, who's now the commissioner, said, this is great data, but I don't know what I'm supposed to do with it. So I created his dashboard. I slimmed it down and took out a bunch of numbers, so it's just a few numbers. And then I went into clip art, and I got a smiley face and a frowning face, and I pasted it onto each chart. And he's like, that was great. That's exactly what I needed. Just tell me which ones are bad and which ones are good. Mm-hmm. And so what you'll find when you create a dashboard, and this is also important when you think about setting it up, your dashboard should be about 3/4 or 75% dynamic, meaning every week it gets updated with new information. And about 1/4 of it is going to be stuff that you might have on there for a while. And then once you kind of get it nailed, like your no-show rate or empanelment or something like that, then you can just move it off to the corner and just update it monthly or quarterly. It doesn't need to be a weekly piece of information because it's not changing a lot. You can see this clinic also did that with the phone efficiency stats at the bottom. They just started reporting them by month. And then when they had that blip, then they went back, last week, 16%. You see that? So they made kind of a big red spot there. So they were doing good for a while, and then as soon as it came back on the radar screen as a problem, they posted it. So these are all options for how you might want to create and build your dashboard. This is another example of a dashboard. The only thing I'm going to point out is that this blue was the pilot team and the RRTs. And then the purple, orange, and yellow, those are different teams that have their data showing. So it looks a little chaotic at the beginning, but once the trends go out a few weeks and months, it starts to become a lot easier to see how each team is performing. So that's another option. The bottom line is a dashboard is not a data report or just an Excel spreadsheet. It has to be an interpretation. This is what one site sent me. Oh yeah, we have a dashboard. I'm like, that's not a dashboard, it's a table. It's a busy table I can't understand. Another site's like, yeah, we have a dashboard and it's even color-coded. I'm like, color-coded what? If it was really color-coded, this optho 83-minute cycle time would jump off the page at you screaming red because that's awful. And so would their 28% no-show rate for optho. Whereas the cycle time for ortho and their no-show rate would probably be green. Another example that a site sent me, it's a lot of data, but it's not a dashboard. That doesn't stir me to action. It stirs me to like reading glasses. But it definitely doesn't stir me to action. I'm like, what is that about? So what I want you to take from this is you can create your dashboard however you want. And we're going to help you to do that with the metrics. But the bottom line is you need to get close enough to the data that the people who are doing the work every day, meaning yourself and your peers, can really clearly see how what they do every day impacts patients. That's the bottom line.
Okay.
Any questions?
No. We'll ask later when we do this.
Okay. That's fair. Rachel, anything you want to throw in?
No, I just think it makes this all real, and I think that it's super helpful for me to think about when I try to communicate with my team and try to share information. How do you make something clear using the tools that you've shown so that anybody who's looking at it, no matter what their role is, can say, oh gosh, this is important, and I can see that this is why the team is choosing to act here. So I really like it. It makes a lot of sense. Thanks, Mel.
Right. The disadvantage for you, Rachel, and your team is that everybody's going to have a slightly different dashboard.
Yep.
And from a project management standpoint, you want all the same data. But what's important to one side isn't important to another side.
Yep.
Paula, thoughts?
Yeah, I mean, I think that one of the things I'm taking away is just that this being more, the dashboard being more accessible to staff and more visible to them. I mean, they're not going to independently go in the computer and look at this, but if it's more visible, if it's posted, that can be something that they refer to and it can motivate them.
Yes. Absolutely. Absolutely. Yeah, we're going to talk at the learning session about how you might share your data.
Okay.
So you kind of be thinking about that. But right now, all I want you to think about, and if you want more information, I have the data nerd side of me has this like whole set of like visual visioning information books, all these quantitative, this is the one I referenced in the PowerPoint in the article, quantitative visual display of data. There's a whole set of these books actually about how different organizations and companies have used data really smartly. So I would encourage you to create something that's really clever and really stirs people to action. I am going to include in your packets at the learning session, but it was also in the email, an article about performance dashboards. Again, this is considered the baseline understanding coming into the learning session because we're going to go from here. So I'm glad you guys were here to get this so that you can move on from this at the learning session and be prepared for that. But if there's people on your team that weren't here for this, please urge them to read the dashboard article and the link on there. It's not the same thing as the video or the conference call, and I'll have this video available for you as well if you want it. It'll be on our website. It's not available for, you can share it with any of your team members. I just want that you come into LS4 on September 4th with a full understanding and thoughts about what you might want for data.
Okay.
Okay?
Okay.
So that's it.
Oh. Okay.
Thanks,
you.
Mel.
Thank you.
Thanks for being here.
All right, take care. You have a good one. Bye, Pamela. Bye, Rachel.
Bye.
Bye. See you.
Paula, I'm sorry. I said Pamela. Well.